According to the National Institute of Neurological Disorders and Stroke, over 20 million people suffer from peripheral neuropathy. Typically, it affects older Americans, but can impact anybody. Joining us today is Dr. Greg Davis, co-founder of Essential Neuropathy and Lee's Summit, board certified in neuropathy. How's it going, doctor? It's good to see you.
Good to see you too. Thanks for having me.
Of course. All right, let's just dive right into it and get the basics out of the way. What is peripheral neuropathy?
So peripheral neuropathy is when the nerves in the body are damaged and become to decay or die. Now that damage typically starts out slowly and gradually progresses over time as the condition worsens. So it's not necessarily a disease in itself, it's the conditions in the body that lead to neuropathy.
Okay, so what should someone do if they find out that they actually have peripheral neuropathy?
So the first thing to do is to seek a professional for a proper diagnosis, and at Essential Neuropathy we actually do specific tests to determine if there is nerve damage present and how much nerve damage is present if it's there.
Sure, and this is probably going to be the big question: if someone is suffering from it, is it treatable?
Well, yes. So the symptoms of neuropathy are treatable, and they're treatable with a couple of different things. Now, at Essential Neuropathy, we use electric cell signaling, which helps the body regenerate nerves and arteries. Now, the most common form of treatment that people come to us is typically pharmaceuticals, so gabapentin, Lyrica, and Cymbalta, and unfortunately, those don't treat the nerve damage. It just suppresses the symptoms and masks pain. We focus on regenerating the body, allowing it to heal. We don't use any drugs, any surgeries, and everything we do is FDA cleared.
Yeah, a lot of people are probably going to jump right to the painkillers and things like that to do it, and it's better to hit it at the source than try and manage those symptoms.
Right, of course.
For sure. Now, this is my favorite part of when you stop by too, because you actually have an offer for people out there, and it's a real nice one too, a $49 neuropathy special. Is that correct?
Yes, that is correct. So what that includes a consultation, an exam, all our sensory tests to determine what's going on with the patient, if we can treat them and accept their case. We also do any necessary x-rays with that offer. And then from there, we calculate the exact % damage the patient has and create a treatment plan for that patient.
And you have to be very busy with the work that you're doing. How soon can someone come in?
So we have our team waiting right now for your phone call. All they need to do is give us a call, and we'll find a time that best works for them to get into the practice and allow us to help them.
Well, doctor, thank you so much. Great information as always coming in here too, helping out everyone out there that may be suffering from this. And if you or someone you know suffers from neuropathy, you can call the number right there on your screen. Call now for your $49 neuropathy special that we were just mentioning. And remember, it's for the first 25 callers. Call 816-600-0801.